As new COVID hotspots pop up across the country, many kids are heading back to school. There are new questions about the effectiveness of the Johnson & Johnson vaccine against the Delta variant. Kana Whitworth is live from Chandler, Arizona, where schools are set to open this morning. Good morning, Kana.
George, good morning. So the staff here at Conley Elementary School has been working around the clock to mitigate the chances of COVID spread, as they are among the first in the nation to head back in the classroom today with no mask mandate in place. And this as COVID cases in the United States are the highest they've been in 2 months. Overnight, a new study raising questions about the efficacy of the Johnson & Johnson vaccine, suggesting that the one-shot vaccine could be less effective against the highly contagious Delta variant. The authors concluding that 13 million Americans who received Johnson & Johnson might need a booster shot. But experts point out the findings contradict prior studies indicating the vaccine likely works well against Delta, and say this study, which is not yet peer-reviewed, looked at blood samples from just 10 patients 2.5 months post-vaccination. In a statement, Johnson & Johnson saying these results do not speak to the full nature of immune protection. The company also saying earlier peer-reviewed studies conducted over an 8-month period show the vaccine generated strong, persistent activity against the rapidly spreading Delta variant. For now, the FDA and CDC saying none of our currently authorized vaccines need to be boosted with an additional dose. The Delta variant now estimated to account for 83% of all new cases. Meanwhile, public health experts monitoring breakthrough cases among the vaccinated, including House Speaker Nancy Pelosi's aide and a White House staffer. Dr. Fauci saying vaccines can protect from hospitalization or death, and breakthrough cases are to be expected.
When you hear about a breakthrough infection, that doesn't necessarily mean the vaccine is failing.
This as some kids are already heading back to the classroom today. Lawmakers in 8 states, including Arizona, have enacted legislation banning school districts from implementing mask mandates. And while kids are less vulnerable, a sobering reminder from the CDC director, more than 400 children have died.
Children are not supposed to die, and so 400 is a huge amount. Now, the American Academy of Pediatrics recommends universal masking in all schools, but George, some parents here I spoke with say they really appreciate the freedom to make the best decision for their families.
Okay, Kana, thanks very much. Let's bring in our friend Dr. Ashish Jha, the Dean of the Brown University School of Public Health. Thanks for joining us again this morning, Dr. Jha. Let's start with that new study on the Johnson & Johnson vaccine. It doesn't really track with the other studies out there. What's your big takeaway?
My big takeaway is that when I put all the data together, I think the J&J vaccine is holding up just fine. We're not seeing large numbers of breakthrough infections or hospitalizations in people who've gotten the J&J vaccine. I think we need more data. But for people who've gotten the vaccine, I would hold tight and not act or worry that this vaccine isn't going to work for you.
And even though there are breakthrough cases, we still know that these vaccines prevent largely serious illness and death.
Yeah, absolutely. And we're going to see breakthrough infections when there are large outbreaks happening overall. When you have lots of people infected, the unvaccinated, and large numbers of virus circulating in the community, we're going to see a few breakthroughs. But the good news is people are not getting hospitalized, people are not dying if they've been vaccinated, and that's the key.
We're getting all this different guidance on masks in schools for kids. What's your advice to parents?
My advice to parents is, first of all, if your kid is 12 or over, get them vaccinated, because that's the best way to keep them safe and to prevent transmission in schools. If your kid is under 12, if you're in a hot spot, it's pretty reasonable to be wearing a mask indoors. If you're in a place with very few infections, I don't think masks are as necessary.
Dr. Jha, thanks very much for your time and your information this morning. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.